Hi, Dr. Gill. I want to thank you for taking the time to be here today and introduce what you do as a functional dentist. Now, many people know me from the classes I teach about breathing, and as a Feldenkrais practitioner, I have studied functional breathing. But after studying the Buteyko method, I went down the rabbit hole of airway health. And that is what led me to contact you. And so, Dr. Gill, could you say a little bit more about what functional dentistry is and what got you interested in it in the first place?
For sure. Thank you, Faria, for bringing me on. And I see you're very passionate about treating your clients and, looking out for them. So what brought me on to become a functional dentist? Well, going to school, we all dentists, we learn to become very good tooth mechanics, meaning fixing teeth. In traditional healthcare model, whether it be medical or dental, we get taught reactive care to, treat after, the problem happens.
Right.
Being a functional or as a functional dentist, I look at why you got there in the first place. So when I see my patients, I sit down pre-consultation and I talk about 5 to 7 things that, lead to comorbidities. I talk about chronic infections, sleep, sunlight or vitamin D. I talk about diet, movement, and genetics. Out of these 5 to 6 things, what is the one we cannot control? Our genetics. Rest of the 5, we can. So if somebody looks at the why, you look at the person's sleep, any chronic infections, are they doing any movement? How clean is their diet? What are their stress levels? We can control all of these. We're going to focus for our talk on the sleep portion, because with sleep comes sleep and stress. With stress comes bruxing, grinding your teeth, and with sleep comes airway. Now, people who are not breathing through their nose, not mouth breathing, there are problems. There are anatomic obstructions happening. They may have a small mouth. It's like parking a Suburban in a compact parking spot. So look at the anatomic, constraints. What are the anatomic constraints in their mouth orally? Mouth is a window to the rest of the body. So a snapshot of what else could be happening. So we're going to focus on the airway. When I see my patients, we, see if they're mouth breathing or they're nasal breathing. How good is the nasal breathing? And, why are they not nasal breathing? I mean, I look at all these things, I may or may not, I treat them with the tools I have in my toolbox. And for the tools that I don't have, I refer them out for nasal breathing, for learning proper breathing, like you. That's
Yes, absolutely. And as we both know, breathing is everything. If you can't breathe, you're not healthy. And so I'm so excited because we're going to do a more lengthy talk, and it's a free event. So stay tuned. There'll be a link below. We are getting together on Saturday, November the 18th at 10 a.m. Eastern Time. So please join us for this talk about airway health and improving your airway health. Thanks very much, Dr. Gill. And I look forward to doing the 1-hour presentation in a few weeks.
Awesome. Me too.